not having a partner with multiple partners.
That is hard to track down. Nairobi aside, there's a song will play for you. Cindy, at the top of the hour. Nairobi.
Did you listen to the Hot Breakfast this morning? Here's what you missed.
We want to talk about cancer, folks, in particular cervical cancer. January is Cervical Cancer Awareness Month. Did you know that? By the way, do you know what cervical cancer is in the first place?
And how it can be spread and how you can prevent it.
By the way, it's one of the biggest killers of women in Kenya today. Can you imagine?
That's so messed
They
up.
say breast cancer is number one. Cervical cancer is right there behind it. More than 5,000 cases a year in Kenya. What is cervical cancer? How is it caused? Can it be prevented? Can it be avoided? Let's talk live in the studio with Dr. Vincent Oyiengo. He's based out of the Kenyatta University Teaching and Referral Hospital. Has more than 18 years experience, had elective experience at the University of Toronto and Princess Margaret in Canada. He also has a private practice at Magharibi Health Specialists Clinic, opposite Timor, right here on Langata Road. Dr. Oyiengo, welcome to Hot 96.
Thank you, Jeff and Nikodhiambo.
Karibu sana. So, a lot of people are wondering, what exactly is cervical cancer?
Cervical cancer is a cancer that affects the woman reproductive organ, that is the womb. Is surface located at the lower part of the womb. And as you rightly put it, is the second most common cancer after breast cancer. But of interest is the leading cause of death in cancer-related cases in Kenya.
Wow. How is it caused, doctor?
Yeah, most of cervical cancer, or 99% of cervical cancer, is caused by human papilloma virus. People commonly refer to it as HPV, which is mainly or almost sexually transmitted, or through body contact, or through kissing.
And you can kiss someone and give them cervical cancer?
Yeah, even, skin contact alone.
Is it anyone can carry it? Like, is it mostly men or women can also?
It's both found in women and men, but the women are the most affected. And interesting part is 80% of women who are sexually active by the age of 50 years, all of them have HPV. But the good side of it is most of it is it regresses spontaneously, or it is transient.
But why is that? 50% of over 50 women? Why? Is that the older you get, or?
Because of the sexual activity. The more sexually active you are, the more chance, or the high risk chance of having HPV virus.
So in a nutshell, everyone has HPV like a carrier. It's just that now when it gets to some people, it can blow up, and to some people, or how does it work?
Yeah, the good thing is most of the viruses are fought by the body immunity.
Okay.
As we find out, as much as 80% will have it in their lifetime, but a good another 70% will clear.
And how many women are you seeing a week, doctor? How many come to your clinic or your hospital with cervical cancer?
At KTRH, you are seeing roughly around 30 women per week.
Every week?
Every week with cervical cancer. And nationally in Kenya, over 5,000 women are diagnosed with cervical cancer, and we have 3,000 deaths annually.
2,000?
3,000 deaths.
Oh my goodness. So tell me, obviously in the urban areas, people are more aware. What about out there in Mashinani? Are people aware? Is there awareness campaigns?
Yeah, of course the government has rolled out public awareness, advocacy to inform the population, especially the women, about cervical cancer. But there are some quotas who actually refer cervical cancer as the disease of the poor, because you find women in the rural area have little access, or find healthcare unaffordable to them compared to the middle class women or women in the urban area who can afford a screen, a pap smear annually or every biannually, compared to their colleagues in the village.
And now, in case someone in the village has no access to medical or to, such facilities, what are the symptoms someone can, tell even a friend, and they tell them, you go for a pap smear? What kind of symptoms when you're having, like, the HPV?
The most common representing symptom from cervical cancer is bleeding after sexual intercourse. That's the most common. Or having a false smelling discharge from your private part. That's the most common. The beauty about cervical cancer is is highly preventable and equally highly treatable. The trick is that it has to be detected early and managed by the right doctor.
So how is it treated?
Of course, it depends on the stage. As all cancers, we have stage 1 to 4. The early stages are treated by surgery, plus or minus chemotherapy and radiation. Then the advanced stages, of course, are treated by radiotherapy and chemotherapy. And there is the terminal stage where we institute palliative measures. But the biggest challenge, of course, is up to 2020, the only public hospital which could offer comprehensive cancer treatment was Kenyatta National Hospital. But since 2021, we have added 2 more. That is where I work, KUTRH, and also MTRH.
Which one is MTRH?
Mweri Teaching and Referral Hospital.
Oh, in Eldoret.
In Eldoret.
Okay.
So you can imagine the challenge the Kenyans were facing before 2020. The queues at KNH were quite insane.
So I've seen you're a gynecologist, oncologist, which means, diagnose and treat all kinds of cancers from ovarian, uterine, vaginal, cervical, vulva, and gestational trophoblastic neoplasms.
Hey, what is that?
That one is going to tell us as the doctor.
Gestational what?
Gestational trophoblastic neoplasms.
Thank you, Nick. First, I'd like to correct you. I don't treat all form of cancer.
Oh, okay.
I mainly deal with cancer of the reproductive organ
Okay.
among women.
So all these ones I've mentioned have got nothing to do with you.
They have everything to do with me, but they're only in the reproductive organs.
Okay.
That's the role of the gynecologic oncologist.
Okay.
That is area of speciality. And the leading, as we have said, is the CS cervix,
Okay.
which you're talking about, cancer of the cervix. But the deadliest is the ovarian cancer, is the silent killer.
Ovarian.
Yeah,
Because that's up in the ovaries. So.
it's worse, and there's a poor prognosis. And that's where you're trying to have the duty about cervical cancer. You can screen it, unlike the ovarian cancer, unlike the uterine cancer, unlike the gestational trophoblastic disease. The beauty about cervical cancer is screenable and it's preventable.
Yeah. So January being Cervical Cancer Month, Awareness Month, Doctor, what do you tell women out there? What you
can emphasize then is to go out for at least screening for pap smear.
From what age?
From they usually say from the sexual, at least once you are sexually active, you qualify for pap smear. But at least after 21 years and above, you can go. If you started sexual debut earlier than that, 3 years from sexual debut, you should go for a pap smear. Women above 30 can go for HPV DNA testing, which is equally available. In the rural setting, we are still practicing what we call VIA, using acetic acid to able to pick the cancer cells.
Well, you said it's called what?
VIA.
It's like a rapid test of sorts.
Yeah, rapid test is
okay.
But recommend every woman at least in her lifetime should have at least even twice screened for cervical cancer.
In regards to cost of going for one of these, let's say a screening or like a pap smear, what is the average cost that someone who has never done this would start planning for it? Because a lot of things sound like they're very expensive.
Yeah, a pap smear will cost you around 2,000 to 3,000.
Okay.
In a private facility, in a public, maybe 1,000 to 1,500.
Depending now on where
you're going.
So it's affordable.
It's affordable, but HPV is a slight on the higher side, maybe 3,000 to 5,000 shillings, Kenyan shillings.
Okay. And I think I'd spoken to someone last year who was saying that there's a jab that's been given to people, to young girls from 10 years onwards.
Yeah, we have the HPV vaccine, which has been rolled out and incorporated in the immunization schedule in Kenya. And it's quite effective. We have like 3 types. 2 types are available in Kenya, the Gardasil and Savirax. And they confer body immunity and prevent you from getting cervical cancer. It's quite safe and effective.
And this is being injected in girls of what age?
From 9 to 15 years.
Oh.
And as usual, they usually have the booster, the catch-up dose, as many vaccines.
Sort of like COVID, eh?
I think that's how you handle viruses, yeah?
Because they keep mutating.
Right.
Okay.
Can HPV cause cancer in men?
Yes, that's a good question. HPV can also cause what we call penile cancer.
Oh, that sounds painful.
Yeah, but again, it's rare. It's rare.
Oh, it's rare.
And it's common in the fifth decade of men.
Fifth
you,
decade.
Yeah, I don't know if Jeff you belong.
I am there.
57.
6.
But anyway, some
I
countries,
rounded off to my favorite number.
some countries like Australia will roll out vaccination of both the girl child and the boy child.
Okay.
But mainly in the low, because this cancer of the cervix is common in the low income countries. And because of economic challenges and limitations,
Yes.
we are focusing more on the girl child.
All right. And for men, is there like a preventive or, like a way you can make sure you don't, the HPV news is not as impactful? You know what I mean? Yeah. Is there like the way you can say I eat lemons to boost my...
No, it's just avoiding the risk factor for the HPV infection. Which one is, first of all, avoiding starting sexual debut at an early age, not having multiple partners, or not having a partner with multiple partners.
That is hard to track now. Nairobi aside, there's a song will play for you. Cindy, what at the top of the hour? Nairobi.
And also, women with many children are predisposed to HPV virus.
Why?
Because it means the frequency of birth. I would call it giving birth, and the more children you want to have is because you're going to get involved in more sexual activity than maybe a nun, so to speak. And of course, smoking also plays a role in causing cancer of the cervix.
How so, doctor?
Are you about to ask how are they ingesting the cigarettes?
So I think we all know prevention is better than cure.
Yes.
Is to put all our resources, mobilize all our resources to screening, vaccination, and early management of cervical cancer, or early detection and management of cervical cancer.
You mentioned lower income countries, you have a higher mortality rate. As opposed to, let's say, the US, you get 2 cases per 100,000 women. Why is that?
Yeah, before maybe answer you, maybe I'll just give you about statistics. Out of the 100% of cervical cancer deaths, 90% occur in low income settings.
Yes.
It's only 10%. And the reason is, in the high end or high resource countries, they are able to have a comprehensive screening system and vaccination, 80%. If you compare to where we are, it's only a quarter or 25% of our country of the low income countries that have been able to implement a comprehensive screening and treatment for screening and treatment center for cancer. And the main reason is, of course, access to healthcare.
Okay.
Affordability to healthcare. You need money to be screened. You need money to be treated. And maybe that's why the government has to come in. Of course, they have played a role since the launch of the 2 public hospitals. Right now, there's other 8 centers which are coming up for comprehensive cancer treatment, and they have to reduce the tax on cancer treatment equipment, drugs, so that they're affordable to the common mwananchi.
And vaccine, do people pay for it? Or
definitely.
Or even the 10-year-olds, 9-year-olds, the vaccine?
They are trying to, there was a rollout program so that they can be given for free in public settings.
Okay.
But in private, you have to pay. But there is a rollout for HPV vaccine in some public facilities.
Yeah. All right. And if someone wants this information, someone's listening to the radio right now, and maybe they need to tell someone more about this information, there are places they can get this information on vaccines, preventive, measures.
It's cervical cancer in general,
Yeah, the information is all over. There's a cancer screening booklet or guidelines which has been produced by Kenyan government. There is in public facilities, all actually county referral hospitals have a screening program which is active.
The one cancer we keep hearing about in women, doctor, is breast cancer.
Yeah.
Right? That's what you hear, mostly breast cancer. Do you think cervical cancer has been, forgotten about because most people talk about breast cancer as, the leading cause in women?
Yeah, the cervical cancer is one of the greatest public health failure in terms of prevention But as you read, I mean, breast cancer is there. I'm not an expert in breast cancer, but there's equal, drive towards also prevention of it, because it's the leading cancer among women in Kenya. And I can't rightly put it that cervical cancer has been neglected. But what we know is that there's been a lot of disruption because of the COVID pandemic. Many resources have been channeled towards prevention and treatment of COVID. And of course, there are other economic demands or from other sectors. I mean, health is not only issue that the government has to handle, the other key areas, the security, education. But what we can always advocate for is the government to put more resources in healthcare management. I mean, adhere to the Abuja Declaration of giving 15% of its budget allocation to healthcare management, capacity building, promoting healthcare, giving, incentives, both monetary and non-monetary, to health workers.
Yeah. And given what you've said, with COVID taking over, most of the resources, does that mean that the number of cases of cervical cancer will be on the rise? There's no doubt that they will be on the rise because it's taken a back seat, obviously.
Definitely, there will be, of course, an effect on that. And you see, what we are saying is that the reported cases, there are a lot of unreported cases. What I'm telling you is what the data we have. There's so many people die in the village or who die from a known thing, and yet it's just cervical cancer. So, of course, there's an impact. But again, it's about a government policy to see how to handle it in a very, diligent or careful manner so that one is not neglected.
Yeah. They also now prevent having multiple partners.
Emphasis on multiple.